Hi, I am Dr. Suresh Rang, Senior Consultant Chest Physician affiliated to Lilavati Hospital and Research Center, one of the prime institutions. We have been seeing a lot of patients with infections in the upper respiratory tract or upper airway, or with, as we say, the nose, the throat, and then going down into the lungs where the breathing tubes get affected. Now, the affection may be because of a viral infection, which may come and go, but once it comes, it can leave damage behind. And on the damage, we can get various other organisms or various other bacteria, fungus, a prion, and where tuberculosis. Anything can come into that because your resistance, which was high, the virus has affected your resistance at that time. That may have also affected your resistance, but once that resistance low, the bacteria comes in. We have various types of bacteria or different substances that can affect the lung. If it goes into the lungs down there, we call it, if it affects both sides of the lung, it is known as bronchopneumonia, when there are patches seen on an X-ray. But if it sometimes affects only one particular segment of the lung, where I've got 10 segments, then you can get what is known as segmental consolidation or segmental pneumonia. Now the question is, how does this pneumonia come down when we have so much resistance of our body? Various factors. Number one, the person himself or herself has a diminished resistance of the body, either because of the illness, because of transplants, because of drugs that are being given that may lower, or because they are in an environment where their resistance can be low. For example, in diabetes, in patients with kidney failures, patients who have been operated, the resistance is low. So therefore they become vulnerable to the infection. Now once the infection comes in, you have to be very careful because there are a lot of complications that come after the bacterial infection comes in. The body fights, but there is a limit to which the body can fight. When they cannot fight, the medical field has to give some sort of an assistance to control that infection. More than that, to also prevent the complications that may come through the pneumonia, either in the form of an abscess or spreading throughout the body, going into the brain, spreading into the lungs and various parts. It is this complication that is. Now, if the infection is acquired outside, it is known as community acquired pneumonia. If it is acquired in the hospital when the patient came in but got it from somebody else, it is known as nosocomial or hospital acquired pneumonia. And you can also get a patient who has been very critical, has gone on the ventilator, then you get what is known as ventilatory acquired pneumonia. Now the pneumonias may be of different organisms. I don't think we should go too much because ultimately the idea is that you should know that to prevent you getting that pneumonia is more important than cure. And how does one prevent? Keeping up one's resistance, controlling your base infections like diabetes, eating well, at the same time eating good food, healthy food and foods that increase your resistance in the body. So taking all in all consideration, there is no such thing as magic in medicine. Medicine is an ever-changing science. So today it might be the bacteria, tomorrow the fungus may take over, then you may get the prions taking over, you may get other organisms taking over. But as time passes by, you realize that your body is the most powerful gift given by God to you. Take care of it, eat well, maintain it well, and breathe well. Breathing exercises, exposure to sunlight and fresh air early in the morning and exercise will go a long way in helping you prevent and fight the disease. Thank you.